Montgomery has been what I call late to the party when it comes to the spread of COVID-19. First, as most people in Alabama know, it began hotspots in Auburn, certainly in Birmingham, Mobile, somewhat in Huntsville, but now it's here. We've been on national news discussing us being a hotspot and why. Well, I believe that it's the same virus that are in other areas that are hotspots, but again, just by transmission was late to here, but it has arrived. We have had outbreaks primarily in our nursing home population, which of course are at increased risk for the disease process, in some of our plants, in some of our chicken processing areas, which began probably a month and a half ago. But on top of that, we've had community spread. By that I mean people who got together at their churches, at family reunions, at funerals, that simply just spread by person to person. So to that end, we are emphatic about stopping community spread. First and foremost, something as simple as this mask will help stop community spread. This mask represents to people a commitment to the community to help stop this virus and stop the death that it brings. The mask itself will prevent a person who's infected and does not know they are from giving it to other people, and also from getting it themselves. This commitment goes beyond the mask. It goes to social distancing. This is a term that we've all learned to live with, but it is an important one. 6 feet at minimum is a good way to keep from droplet from one patient to the next. Next would be hand washing. Something as simple as when you go to fill up at a gas station, you touch the buttons for your credit card. You need to know that other people have been there. You need to wash your hands, have on hand alcohol, if at all possible, to keep from transmitting something as simple as pumping gas. So important is masking, keeping social distancing, washing our hands anytime you think of that. And I think most importantly are the young people who are going out who probably will survive this disease. I think what they don't understand is they can potentially bring this home to their family, their loved ones. So even though they survive, they may be responsible for getting their grandmother or grandfather sick. So very important that our young people understand this.